Chuula Clinic, a rural health center in Mazabuka district in Southern Province. Despite looking like any other rural health center, Chuula Clinic is special in that it has not recorded any positive case of local transmission of malaria in the last 3 years. Nurse in charge Matilda Mulenga says this has been possible as the rural health center staff have been using a robust system to ensure that members of the community follow the laid down guidelines to prevent malaria. Mulenga says they have involved 3 main stakeholders who are community health workers, community headmen, and the clinic itself.
Chuula has maintained 0 incidents of local cases because as Chuula Clinic we are always ready and available to test and treat for malaria. When we have a case, we make sure that cases are followed up. Family members and the neighbors around get tested. We have also extended to testing to visitors in the township, even if they have no signs of symptoms of malaria. With the help of public health team, community health workers and local leadership, other preventive activities are implemented in the community.
However, both the district commissioner, Jane Chuula, and the district health director, Dr. Fallon Mwaba, agree that the biggest threat Mazabuka faces relating to malaria is positive cases from migrant workers. The migrant workers come from as far as Western Province, especially during the harvest time as the district is centered around sugar estates.
This time around the factory has started running up to November. So we have people who come to look for employment in Mazabuka, coming from as far as Western Province and other parts of Zambia. It is during this time of the year where we are in when we record high cases of malaria. And these are imported cases, if I can put it that way.
I mean, that comes from all over the country. And when they come, a number of them would come with they're already infected with malaria. And it's quite difficult to implement certain preventive measures there.
Representing the Minister of Health, Dr. Jonas Chanda, during the commemoration of World Malaria Day held in Southern Province, Director for Health Promotions and Social Determinants, Dr. Abel Cavallo, says the nation needs to emulate the system used by Chuula Clinic so as to roll malaria out of the country.
The dedication that we have seen exhibited by the staff, I think that gives us a great lesson and tells us, let's say, if we incorporated that as a nation and replicated what is happening in Chuula community, countrywide, indeed, malaria elimination is possible.
Virginia Chilongo, Movie TV News, Mazabuka in Southern Province.